Here I am with Jim. Um, we're going to introduce ourselves. We're both physicists, and we're both critical readers, avid and critical readers of the medical research literature. And we have an interest in the coronavirus, and we're going to discuss it in a critical way today. That's our plan. So, Jim, maybe you could just say who you are.
Yes, my name is Jim Larsen. I work at the Technical University of Denmark, where I teach mathematics and physics. And actually, I'm not a physicist. I'm an engineer with a specialty in technical physics and applied mathematics. So I studied engineering, and one of my interests is studying the medical literature. And like you said, I'm skeptical about some of the medical literature that I'm reading, especially how they conclude in their studies compared to the data they collect, stuff like that. And then I'm interested in this coronavirus thing, and I know you are as well. So I think we're going to talk a little bit about that and try to see what we can say from the data that we have available.
Yeah, I know that your readings have been very in-depth and have been concentrated on cancer, and that you've made you have interesting insights about that. So maybe other videos we will be able to discuss that. But I want to present myself also. For those of you who are new here to this channel, I'm Denis Rancourt. I'm a physicist. I'm a researcher presently with the Ontario Civil Liberties Association. I've written over 100 articles in leading scientific journals on various topics, including all kinds of physics and also environmental science, soil science, and so on. So I tend to be interdisciplinary. And I'm able to read complicated scientific papers, and I know experimental techniques and measurement methods because I taught it at the graduate level, all kinds of measurement methods, spectroscopy, microscopy, diffraction, and so on. I know all of these methods, and I understand data analysis and how to do error calculations and so on. And so I have that critical eye when I read scientific literature, as you do, Jim, I know. And so that's why we're here together to give this kind of pedagogical discussion about the coronavirus. So you wanted to start with a question.
Yes, I can understand from earlier versions of videos that you have been making about the coronavirus that you are of the opinion that this corona thing is like overhyped, hysteric reaction almost from most countries in the world right now. And my question to you is, from the data that we have available, how would you say that you can conclude that the reaction is not, what could you say, suitable for what we have now?
Yeah, well, I'm not the only or first person to say this. Many experts and educated people have made public pronouncements to the effect that that the lockdowns in particular applied to entire countries is a vast overreaction. It's just completely disproportionate compared to what we know about the pathogen and the risks that are involved. So I don't want to pretend that I'm the first to say that, but it seems clear to me that that is true, that it's a vast overreaction. And it's in that sense that I would say that it's a hysteria. It's a global, nationwide, institutional hysteria that has many layers of positive feedback to keep the hysteria going. It's very unfortunate, but that's what it is. And the reason I say that there is no justification for these lockdowns is that we know a lot. We know more and more about this pathogen in particular because a lot of scientists the data is being publicized all the time. There are many measurements, and scientists have expressed their evaluations of the virulence and also the lethality, how lethal this pathogen is. And these are like the leading scientists. Ioannidis, who is that's a Greek name, professor, doctor from Stanford University, was one of the first to do. He's a leading statistical and error analysis medical researcher, and he was the first to say, "Well, look, we've got a whole ship of people, 2,800 people. who were all analyzed. We figured out who was carrying the virus. We figured out who got sick and so on. We have at least that. And from that, I deduce that, this is the infectious fatality rate, which is the most important thing. And he found a very small number, which is comparable to seasonal flu. So, and he gave error bounds on that. So, I mean, that's pretty convincing to me. You're going to have to show more data that contradicts this already very good data. And then the data keeps coming out more and more. Just yesterday, there was a big study in Lancet by 33 authors that essentially vindicated those first attempts at getting this number. You see, this number is the infectious fatality rate. That's a key number, because that basically says, if you catch the virus, if you carry the virus, what is the chance that you're going to die from it? That's a key number, right? Because if that number is very small, then everybody on Earth could catch it, and the human population would easily survive that. You know what I mean?
Yeah.
And what it means is, when that number is small, it means that you're recovering. It means that you're developing an immunity and you recover. The great majority, virtually everyone, does. As is the case with seasonal flu. People catch it. It can be very, propagated all over the place, but everybody recovers. You go home, you rest, you recover, you develop immunity. So it's because of these numbers that I say that the normal reaction should have been, if you have symptoms, since we know that without symptoms you're not propagating it. Some early studies showed that fairly convincingly. If you have symptoms, stay home and recover. That's what the signal should have been. And only the most severe cases can be looked at and treated. But these are people that are already in hospital, that are already being cared for because they already have other conditions. These are the people that died had a host of other conditions. So for all these reasons, I say there is no doubt that these government reactions were overreactions, vast overreactions. There shouldn't have been a lockdown.
If we go back to the 2,800 people on that boat, would you say that those 2,800 people would be a good way to represent the whole, the average population, or how would those people compare to the general population?
Yeah, that's right. And obviously, the greatest expert on these questions is the one who took the first look at just that small sample and basically used his methods to correct for age. Like, they have an age distribution for and did the best he could to extrapolate what this means to the general population. Now, there's always a chance that and now we know, of course, the study of yesterday shows how dramatically different the numbers are for young people, children, adolescents, young adults versus the elderly. The numbers are dramatically different,
Yeah,
but
that's
are
part of the
still.
reason why we see Italy hitting so badly, right?
Sure. And there's been a lot written about that and a lot analyzed on that. And the other important factor is that just because you died and there was a presence, according to these tests, which are, again, can be debated how good are the tests, but let's say you do the test properly and you do PCR and you really identify that it was specifically that pathogen, just because you had that pathogen present in your body in a hospital, which is, if it's very contagious, is not surprising. Is that what caused your death? And so there's the whole question of what is the cause of death, which is always a difficult question for any
Exactly.
medical practitioner. But there was a tendency to say, well, the coronavirus was present, so we'll count it as a death from coronavirus, which is completely incorrect. And that's been commented upon and evaluated. I think they found that from memory, only 12% of the Italians who died who had coronavirus died from coronavirus.
And how
So
did we? Do you know how did they quantify that? When we just count all the people that died that had corona, and we don't know if they died from corona or with corona,
yeah,
how would we possibly be able
well, that
to quantify the
yeah, I
12%?
mean, just from my reading of how cause of death is established, it's a difficult task. You have to ask yourself, okay, the metabolism of the person has failed, fatally failed. what caused the greatest damage to the organs, to the critical organs, to the vital organs? What caused the greatest damage? What is the main source of the cause of death, right? That's what
Yeah.
you have to ask yourself. So, were there tumors degrading the function of vital organs? Was there a heart failure? Was there, so many things? So you have to look at that, and you have to be sure that if they did not have the coronavirus, they would have survived for a long time, even with the condition that they had.
Yeah,
And then
or
you
you could
say, well,
ask,
okay, what's a long time? And so it's a difficult question, obviously.
yeah, you could even ask the question, how many of those people that are counted dead with corona would have died from a simple cold or a flu? It's hard to tell, right?
Absolutely, that's a really good point. What are all the viruses that are actively present in our bodies and that can take over or take advantage of your damaged metabolism, right, and your damaged immune system? I mean, generally speaking, in microbiology, the microbiologists have a saying, which is there is everything everywhere, which means that all the pathogens you can imagine, all the microbes and everything, they're everywhere in the environment, and they're just waiting for the proper environmental conditions that they will be able to compete against other pathogens and against other pathogens that want those same resources effectively against them, right? So this is a very good, I think, starting idea, is that we're probably always carrying a whole suite of viruses in our bodies. And a lot of them would be dormant, a lot of them would be inactive, or they would come and go. But the only time the immune system kicks in is when you have to fight it, because it has conditions such that it can propagate in the cells of your body. And so it starts to damage the cells, kill the cells in your body. And so there are triggers that tell the immune system, okay, we have to defend against this. But generally, do you even have to catch a lot of these viruses to die from them? That's not a silly question. It's a very
Yeah.
good question. So yeah, I think your point is, do if they died, is the test specific enough to identify the particular pathogen, this particular strain of virus, or was it another strain of another virus that also attacks cells and would have caused the death? I think that's a really good question. These are all valid questions. And, you never get really good, solid answers to these questions when you read even the most advanced medical papers about this thing. It's always frustrating when you're reading the literature. Um, but yeah, I agree with you. It's a good
So if we
question.
just look at the numbers that we can get from different sites and so on, what would you say that, in your opinion, what can you tell from those numbers? We know that there are about close to 1 million people affected by the virus now that we have tested, right? And about perhaps 45,000 people died associated with the coronavirus. Is there any way that we can take those numbers and say, okay, how many of those deaths are directly caused by corona? Is there any way we can
Well,
actually
that's what the
calculate that
numbers
number?
that's what the numbers intended to, when scientists evaluate this number, this infection fatality rate. That's what the number is intended to represent, right? It's if you're infected, what is the probability that you will die from it? That's what the number means. And so that the whole idea of that kind of evaluation is to get that number. So let's say you have a number. A good estimate at this time of the number is maybe 0.1%, let's say. Okay. So, and the most recent value on average, including elderly people, is 0. I think it was 0.6% is what they got in these 33 authors in the latest Lancet article. But let's say, I think that's an overestimate from reading the paper, but let's say it's about that. Let's say zero point 0.1 or 0.2%. Okay, that means if everybody on Earth got it, zero point 0.1 or 0.2% of the Earth's population would die from it. So, um, that's the worst case scenario. But of course, you're talking about the dynamics of how does a disease spread, and let's say that you can't do anything, that's a hard number, and that's the fraction that will die, which is what it's meant to represent. Well, then it's a question of, will it spread to all the regions, to all the continents? Will people develop immunity quickly enough that they stop spreading it? And once everyone who's going to get it, because it's inevitable in the sense of where they live and they're close to people and so on, it's virtually inevitable. Once everyone who's going to get it has got it, and they develop their immunity, and the virus is not propagating anymore because you don't have symptoms and you're not coughing and so on, then it's over, at least for a while, until by some accident it may start again. But if it starts again slowly, immunity is such that it'll damp it out and kill it, you know?
Yeah.
So it's a question, it's a dynamic process where you have to get like a critical mass going before it'll spread. Okay. And that's the kind of game it is. So if you're modeling it, and I think that's how the models work, it's a bit like nucleation and growth in physics. You have to have a critical nucleus, and then you have growth from that. And nuclei can arise in different places, and so on. So that's what you would consider. But overall, it it's exactly the same numbers as you would get from a normal seasonal flu in terms of this rate. And the symptoms are not any worse. Nothing is particularly special. The people who die from flu are people who have pneumonia, who are elderly, and who are in a hospital. Nothing is different. So there was really no justification for these lockdowns.
We
And
hear people talking about the precautionary principle here. What would you say? What would the numbers have to show you in order to, if any numbers could exist, that would convince you that we should do something like this, that the reaction would be suitable, from...
Well, if you have numbers that allow you to conclude based on the numbers that a lockdown is appropriate, then you don't have to use the precautionary principle. You're basically using the numbers and the knowledge that you have to say we have to do this.
Yes.
If you have to use the precautionary principle, it means you don't have numbers, you don't have information, you don't have data. And my approach is, if that's the situation, you don't do a lockdown. You don't imagine the worst case and do it for that reason. I think that is irrational. So I'm one of these people who's very critical of the precautionary principle. I do not accept the way that it's being used in environmental science and so on. I think it's nonsense. I think it's basically a way of justifying action based on your imagination. If you've got the numbers and you can calculate a probability, you don't need it. And if you don't have the numbers, you shouldn't be doing anything that could potentially
No,
harm.
then you should go and get the numbers, right?
Exactly.
That's
The
one of the
point.
things I have been asking myself about. Why don't we test a lot of people that don't have any symptoms at all? Because in order to calculate how dangerous this coronavirus is, we need information about how many people are actually infected in society that don't show any symptoms at all.
Absolutely, but that tells you about propagation of the virus. That tells you about it shows you the roots of transmission of the virus. If you do that kind of broad testing, you can identify the vectors of movement through society. And so if you are a country like I believe it South Korea that did this very, very extensive testing like that, and they were able to quickly identify how, where it was originating, how it was propagating, and tell those people go home, stay away, and they killed it that way. They didn't need lockdowns. So that tells you about these movements, so that everyone can develop their immunity before it spreads. You intervene where you need to. So broad testing and rapid testing and reliable testing allows you to intervene in a targeted way rather than have a lockdown. If you but again, just the usual thing, which is, if you have symptoms, stay home and recover, is enough. The governments don't have to do anything. This was not a case where the governments needed to intervene. They needed to uh, say, well, okay, China may have overreacted. We're not going to overreact. Stay calm, people. If you have symptoms, it's, from what we can tell from the original numbers from China, it's not that deadly. We're not going to believe that it's that deadly until we see it for ourselves. So for now, just do what you would do with the flu, and that would have been fine. In my opinion, that
Yes.
would have been totally fine. There's something else I need to say, Jim. Um, the whole thinking of we've got this pathogen that attacks us. We need a vaccine and we need a cure and we have to intervene. That whole thinking, to some degree, is wrong, in the sense that viruses have been co-evolving and coexisting with living cells since there were living cells, as far as we know. 4 billion years of coevolution. They're not going away anytime soon. They're always going to be there. They always are there, and they're always mutating and finding new and clever ways to momentarily fool our immune system. Okay, that's always going to happen. We can't get into a routine of so therefore what we need to rely on is what we've always relied on, is our immune system. So the real question should be, what makes an individual healthy? What makes an individual metabolically healthy enough to have a strong immune system?
I completely
Those
agree with
should
that.
be the questions that we should ask, and there are many answers to that question. And it's a much better approach. It's a distributed approach to fighting disease. So you give individuals what they need to be healthy,
Yeah,
um,
I
rather
completely
than
agree. When
rather
you when
than bring NATO and the U.S. Army in to fight the virus, which is the kind of silliness that we have now.
Yeah, I remember I read a couple of studies on the death rate from measles, right?
Mm-hmm.
And from the data, you could see that the death rate from measles would vary 2 orders of magnitude from the nutritional status of the people who got infected with measles. So that
Yes.
tells you that it's really important what you eat and what your nutritional status is and stuff like that to build up your immune system to be able to fight pathogens when you meet them. So,
Absolutely.
and we don't hear much about that in the news, right? That you
I
have to
don't know
build
if
up your
build
immune
up. I
system.
don't know if build up is the right term, but at least create conditions where it's not being degraded. I'm not. I don't completely agree with the nutritional beliefs that you can build it up, by eating the right things and so on. But I do know that there are many stress that perceived stress on the individual is a huge factor, and that there are many stressors, environmental and psychological, that seriously affect individual health. And so you can stop degrading your immune system. You can stop suppressing it. I think that's the way to go. But yeah, yeah, for sure. But
Yeah,
this,
perhaps that's not the right term to build up the immune system. But when you look at simple diseases like scurvy, stuff like that, you know that you can die from lack of vitamin C. That's only one,
right, right.
vitamin, and you can
Well, the,
you can
the
die from
image,
pellagra if you don't have any niacin available and stuff like that, right?
absolutely, absolutely. And the salespeople, the pandemic industry, the global pandemic industry, they like to bring back the Black Plague. They like to have this image of the Black Plague. But this is something historic that happened at a time when life expectancy was already very low. Individuals were not healthy. There were massive amounts of individuals that were being having their health suppressed in very serious ways. So how is that comparable to, all the good nutrition, vitamin supplements, everything that we have nowadays? It's a whole different world in terms of individuals dying from a pathogen. Now, I think you can't use these analogies from the past. That's my sense.
Would you say that, in your opinion, the reaction that we see from every state almost and every country right now, would you say that it must be based on fear rather than rational thinking and science? What would you what would you say
I,
about that?
I think it's not. Fear is certainly an important factor when it comes to individuals. When it comes to nations and countries, I think geopolitics plays a big role. I think that economic trade plays a big role. For example, China, I think, reacted like it did because it saw a very real potential that it could be blamed for something that it was being told by a few scientists was potentially very dangerous, and that it would be blamed because the real initial spread, the real critical nucleus was in Wuhan. So um, it was told by a study that was done by 3 Hong Kong scientists, that the thing to do was to lock it down and that this was very serious. And I think they got scared. They had a scared reaction, but not because of fear, of course, but because they saw the potential of having the global image that they caused this because they did not react appropriately.
Mm.
Okay. And that it could spread to the world and so on. So I think they overreacted in that way. That's my guess. But there are many reasons for, there are many ways to exploit a pandemic of this type. And there are many players exploiting it in various ways. The domestic politics of the USA is a really good example. There's no doubt that the Democrats have tried to exploit this by trying to build the media image that Trump is being incompetent and is not taking this seriously and so on. And then recently, Trump accepted a huge airplane full of aid from Russia, which is a very clever, I think, move to say, well, okay, so it's a way of diffusing this idea that Russia is the enemy, because Trump is of the elite circle that does not want to directly confront and compete with Russia for geopolitical reasons. They would rather do something else, which is to uh, take and clamp down harder on Latin America and so on, right? So there are these two large elite factions in the U.S. that are fighting it out. So they're going to exploit whatever media thing comes by that can be exploited for sure. When the other interesting factor of this regarding the media is, globally, the media, at least the Western media globally, and they lead a lot of the other media, virtually all the media, all together in synchronicity decide that this is a terrible, dangerous pathogen. Okay? When does that happen? You know, this is not a phenomenon of independent thinking publishers that decide how to get readership. It has nothing to do with that. There's much more, I believe, much more coordination going on when you see that kind of thing. It doesn't happen completely by accident. Okay. The editors are in contact with powerful people who nod that yes, you can cover this. Okay. I did a study of regarding climate change in the mid 2000s, around the Al Gore film period. All of a sudden, across the world, instantaneously and in synchronicity, all the media started covering climate change as 5 times more than they used to overnight, everywhere, all together, and as something that was seriously dangerous. Before, the media was all over the place, all over the map. They were being critical of it. They were letting both sides of experts debate it and so on. All of a sudden, it was synchronous. Okay, I wrote about this in a big report that I wrote for the Ontario Civil Liberties Association. So I do not believe statistically it's impossible that that happened by accident. What it suggests to me is that there's some strong levers at play here. Whenever there is an issue that a certain group of global financiers can benefit from, whether it's to create a carbon economy or whatever it might be, they can um, they can cause a bushfire of media attention immediately. And I think that certainly would have played a role in this case. That's
Yeah.
my opinion. That's what I think. We need more
Good.
people studying this, the statistics of media reports.
Yeah, that's interesting. In
Yeah.
Denmark, we have a professor of medicine called Peter Götze. I think you already know about him, right?
Yes. Yes.
He's been writing a little bit about this coronavirus, and in his opinion, it could be that what we are doing could cause more harm than actually good. Just the death that you would expect from the economic crisis and stuff like that could happen because of of these reactions. What are your thoughts about that?
I completely agree. I don't know Peter personally, but I really admire his work and his professional ethics. I think he's a remarkable man. Um, I think he's right, but there's also another aspect which I would add to that in terms of the harm that could come from if we routinely start to do lockdowns. Uh, there's not just the harm to civil liberties, there's not just the harm to democratic systems and to getting us used to being dominated by totalitarian states and the introduction of police state methods everywhere. That's certainly a huge danger for societal structure and stability for sure. But there's another danger. What happens if you start using um, um, bacterial drugs to fight infections routinely? Okay, antibiotics. What happens if you start using antibiotics in your animal populations regarding food and in medicine routinely everywhere? It just becomes routine. We have a drug that can do this, so we do it. Someone has an infection, we give them antibiotics. What is the end result of that? Well, we see it. You get superbugs. You
Mm.
get incredible food poisoning agents from pathogens that are created in animals that are subjected to foods that they shouldn't be eating, and then they get sick, and so you give them antibiotics and so on. The end result is a mess biologically. It makes us less healthy and more susceptible to all kinds of purely biological dangers, I would say. Um, well, you might think that the vaccination and immediate strong intervention whenever there's a virus, a new strain of a virus, if you start doing that systematically, you don't let it spread, you don't let the population develop its natural immunity, um, then what will be the end result? It's almost like you'll be piling up this lethality without practicing your immune system, without continuously educating it with the seasonal flus and everything. You'll be building it up and building it up, and then you might have a real catastrophe. I don't know. I tend to think of an analogy, something that I have studied as an environmental scientist, which is forest fires. Okay, the forest fires, people think that you prevent forest fires by not lighting any fires. Okay, you make sure that there's no ignition sources, right? Well, that's completely wrong. Forest fires will always occur and have always occurred on the planet as a result of drought and accumulation of fuel in the forest. Okay, if you have dry piles of fuel for a long time, you will get ignition and you will have massive forest fires. There's nothing you can do about it. Okay, I've studied this in detail, looked at all the science of it, have explained it. I think that it's possible that human health regarding the immune system is a similar kind of system. I'm thinking out loud here, but if you're not constantly developing your immune system, in other words, having small fires every once in a while to get rid of that accumulation of fuel, which is what has happened naturally regarding forests, then you could get a real catastrophe in the future. I'm just thinking out loud. That might be, I'm sure a lot of medical researchers would say he's crazy, but I
Yeah.
think crazy ideas can be useful.
Yes.
Right now, we've got a very narrow vision of the whole system, which is hurting us greatly, I think.
So you're saying it might be a better idea to just, perhaps get the virus and again and build up. You don't like the term build up the immune system, but then develop an immune system that can handle this pathogen, and then
Yes.
perhaps your immune system has learned something from this that is even
Why?
better than the vaccine.
Absolutely. Why do we think we can interrupt 4 billion years of coevolution of mutations being countered by an adaptation of your immune system? Why do we think that we're so clever now that we don't need to do that anymore? Okay, we can just avoid ever being sick or having the sniffles from now on. We don't need it anymore. Okay, we'll just wear masks all the time, and we'll this and we'll that and so on. I think we're being a little bit silly to think that we can do that.
I see your point. It might be wrong, but it doesn't harm to ask the question at least and to think about it.
Yes. Yeah, that's what I'm. That's what I'm proposing.
Yes.
Well, now, is there another area? I think we've gone on for a long time. I don't know if people are going to want to listen to us this long, but is there another couple, one or two vital areas that you wanted to explore before we shut down?
Well, one of the things I've been thinking about with this coronavirus is how could we try to estimate the number of people that will be killed because of the actions that we are taking? You know, when we lock down the countries, and it's gonna affect the economy in each and every country, right? And my thinking about this would be that it would affect the poorest people the most. And perhaps if you're looking at the poorest people, they are living on the edge of survival, right? What happens if you take away 20% of those people's income? Would they die from it, and how many people would die from it? And we have to compare that number if we were able to estimate that number with the number of people that die from the infection itself, right?
Well, some very serious research is needed on that question that you're asking, and I can tell you right now, it will not be funded. Okay,
no.
That research will not be funded, so it will have to be done by these Skype discussions and so on, right? But that is the saddest thing, is that the most important and vital questions will probably not be answered. They won't be taken seriously, and instead we'll concentrate on, where is the vaccine going to come from, and which private company can we support and bail out so that they can develop this efficient drug and so on. But already we know from sociological studies, from media reports and so on, that domestic violence has risen dramatically in several countries where there are lockdowns. We know that potentially people have reported that there's potentially more suicides. We know that people are drinking more, alcohol, I mean. So there are probably consequences of that to relationships, to families, to family structure, and so on. I mean, we've completely interrupted the lives of people. Now, it's one thing to have a couple which are both professional and have routinely worked from home to continue working from home, and they know how to organize things and they have resources, and that's fine. They're happy to get a break. I mean, there's a whole industry of how much fun this lockdown is, right? But what about the more working class family where there's a delicate equilibrium between how much time you're going to fight at home and how much time you're going to fight with your boss, and all of this. That's a whole other sociological landscape. So I think these are vital questions. Absolutely. Health of the individual surviving in what is essentially a dominance hierarchy, and you change the rules of the game suddenly, and your income is going to come in Canada from unemployment insurance, where it used to come from your labor and your relationship to your employer. Okay, these are huge changes, massive changes, and I think the domino effect of that we're going to be seeing for a long time. And unfortunately, it will not be thoroughly studied. So we won't really understand what happened and how important it was. Yeah.
One more question I have for you, Denis. When you read about this, a lot of people say you cannot compare this to the influenza virus, because the influenza virus is a known virus. We know it, but this one is a new one, so we don't exactly know how we are going to react to it. Do you think there's any validity to those arguments? And if not, why not?
No, I think it's rubbish to say that kind of thing. This is just an example of a more or less, in terms of its lethality and in terms of how much it propagates and so on. It's a more or less typical virus, and it's just one that we, because of the media attention and because of this reaction, that we happen to have studied a lot. Okay, we're now studying it intently, so we're finding out how it propagates, exactly how lethal it is, it is to whom. We're finding out about this particular one where we could have done the same studies for any seasonal flu virus, and we would have found out the same things. And also the media reaction and the hysteria that has been generated by global planners basically could have happened any time that there was an occasion for it to happen. I think in this case, the occasion was created by the fact that China overreacted like it did and did the lockdown. And that opened the door to this well-planned, well-rehearsed global pandemic industry fabrication that spread into the media instantaneously and led to the kinds of reactions that we have. And one component of those reactions is people want to be saved. People want to be taken care of by their government, and people want to know that they're in a fair society where the government is taking care of the really big dangers that they as individuals cannot take care of. And so politicians were being rewarded by public agreement by doing things like lockdown and others. They're being rewarded for this. They became heroes because they said, we're going to violate your civil liberties like never before, and everyone would cheer on because, I'm going to spend some time at home and at least I won't die from this virus. That's the environment that was created by this media, and that the politicians flourished on and exploited. Many politicians, and I'm talking about city officials and provincial leaders and national leaders, they all did it. It's really kind of disgusting, I would say, to have reacted that way. Where traditionally, in a more stable society where democracy is stronger, the leaders will call people to calm and to reflection, to not overreact. This was the opposite. It was like a bushfire.
So would you say that there's some probability that what we see at the hospitals in the media, that the hospitals are, some places overrun by people infected with the corona, is like more a reaction from the public than it is actually from the virus itself?
That's a big question. A lot of people are pointing out that the hospitals are not actually that busy. A lot of hospitals are not that busy, and and a lot of people are suggesting that people ran to hospitals in certain circumstances because of this, and that this would have helped to propagate it. I mean, all of that would be very dependent on the particular hospital in the particular city in the particular country and the procedures that are being followed and everything. So it's hard to tell all of that. But again, many studies could be done that would answer those questions. Was it, and I wonder about all kinds of things. I wonder even, if wearing a mask is a good idea. Not in terms of stopping you from getting it versus getting it, but just as a physicist and as naive as I am, I'm thinking, okay, you're wearing a mask to stop the droplets that are carrying these viruses, right? That are being coughed out by people. That's basically it. You're trying to put a barrier against transmission. Okay, but if you're breathing through the mask, you're breathing in this air. I'm a physicist. I've studied colloidal particles in suspension in a fluid and so on. The particles are going to come towards you and be trapped on the mask. But it's a fluid. It's a droplet of fluid with viruses particles in it. That you know that droplet's going to evaporate as you breathe. Will the virus particles stick to the fibers of the mask, or will it go into your lungs just from the air flowing through the mask? All these questions, like how well is this understood? How do we know, depending on the ambient humidity, where you're living, what kind of mask you're using? All these studies would need to be done to figure out if masks are a good idea. They haven't been done. It's fair to say I'm probably close to 100% correct when I say the following. We're 100% ignorant about what's going on here and what we should do. Okay? I'm probably close to being completely correct if I say we're 100% ignorant. That's my sense of, I mean, come on. And when I say this kind of thing, people get very angry at me, Oh, who are you? You're not a medical doctor. You're not an expert in anything. You're not this, you're not that. We have all these panels of experts, Are we just going to believe you because you're saying something on YouTube and forget about all the experts? My answer a lot of the time is, yeah, read the papers yourself, develop your common sense, develop your judgment. Go, you now have access to Google Scholar. It's on your computer. You have access to all the legal decisions. You can find out how this was litigated in court and what the arguments were regarding medical errors, regarding everything. Everything is at your fingertips. You have to go beyond just reacting on Twitter and Facebook and actually do some reading and actually ask yourself, how does this work? How can I understand it? Let me hit the dictionary button on my computer and find out what these words mean, and start thinking for yourself, because if you're not doing that, uh, don't tell me that I'm not an expert.
Yeah. So your point is, do your own research, and even though you don't feel like a researcher, perhaps you're still better off trying to research something yourself than just believing what other people say you should believe, right?
Especially the media.
Yeah.
Yeah, exactly. I agree with you. Yeah, that's what I'm saying. I agree with you that that's what I'm trying to say. Well, Jim, I think we should cut it. But it's been great having this conversation with you.
Sure. Thank you for your time, Denny. It was
Yeah,
nice talking to you.
it was my pleasure.
I think
And
we should talk again if you have time sometime in the near future about perhaps climate change or some of the other areas that you have been studying
medicine.
in
Yes, we will
medicine.
do
Yes.
that. Bye for now.
Bye bye for now.